Hello there. I thought I would make a video explaining to you the difference between urgent care and ER. Do you know the difference? All right. First of all, we'll talk about urgent care. Okay, urgent care is usually assigned to you by your insurance. You have a specific urgent care that you can go to, and you can't be seen at that urgent care unless you have insurance. Okay, you have to have some sort of insurance that assigns you to a specific location, or if you have like Medi-Cal. I don't think anybody has just Medi-Cal these days, but either way, you have to have insurance to be seen at an urgent care. Otherwise, you'll walk in there and, if you're dying or, having something major going on, they'll call 911 and get you an ambulance. So basically that's urgent care. Okay, now the ER. The ER has to see everybody. They have to treat everybody. Doesn't matter if you have insurance or not. That's the bottom line. They have to stabilize you. They have to treat you. They have to see you before they can send you to, like, let's say you walk into an ER that's attached to a private hospital. Then they still, if you needed to be admitted and you didn't have insurance, then they would have you admitted to a county facility. So, and then they also would apply for you to have Medi-Cal and all of that. So they would get you set up to be able to take care of the bill if you didn't have any insurance. But the law is such that if you walk into any emergency room, you can be treated. Now, emergency rooms also have a division. They have the main department of the ER, and they also have what's called like a fast track. Rapid area for things like if you come in for a cold, a cough you've had for a while, you stub your toe, whatever, hurt hand, something minor that doesn't require the main department of the emergency room, they'll send you over to the fast track area. So it's similar to an urgent care, but it still falls under the emergency guidelines as far as even if you don't have insurance, you can be seen there. So a lot of people think that you have to have insurance or pay some huge copay, but if you don't have the money, even if you have the money and it says your copay is $50, if you don't have it, they'll bill you, because the emergency room, the main purpose is to treat the patient and then deal with the bill. So that's how emergency rooms are run. And urgent cares are also the same in that you have to have insurance and then pay your copay. I don't believe that an urgent care will see you without it. That's just my guess. But you have to have insurance to be seen at an urgent care because that's the way that they're set up. So it's hard for a lot of people to believe that people actually go into the emergency room for minor things, but they do. I worked in the ER for 14 years, and people came in for all kinds of very, very minor things. And a lot of times it's because they didn't have insurance and they don't have a doctor to go to, a regular doctor. So they would come in for things like a stubbed toe or a cough that they've had for 20 minutes or for 2 weeks. It's either one extreme or the other. They either come in too soon and don't give things a chance to resolve on its own, or they come in and it's been going on for a long time and it's just like, why didn't you come in sooner? So, you get both of those extremes. But, and a lot of people don't even understand that they can go to any emergency room anywhere. It doesn't matter what insurance you have. If you need to be seen, if you're having chest pain, especially stomach pain, anything like that, if you don't feel right, if you're confused, if you have a loved one that's confused and you think they might be having a stroke. Strokes don't always come with facial droop or one side weakness. A lot of times they do, but they don't always. But if you have a loved one talking strange and not making sense, you would want to get them evaluated, because that's just the smart thing to do, because it can present in different ways in different people. So that's that. So now you know the difference between the emergency room and urgent care and which one to go to depending on what's going on with you. Of course, it's always better to go to your doctor, but sometimes I understand that doctors just don't do enough or check out things the way that we will. The emergency room will check everything. They run every test. They try to find out what's wrong with the person because they only have that one visit. So, sometimes it's a little more effective. And if your doctor is ignoring your symptoms, saying, oh, nothing's wrong with you, but something's wrong with you, sometimes it might be better to go to an emergency room to actually get someone who's going to rule out all the serious conditions, because that's what we do there. So, all right, hope this has been helpful. If you like the video, share it, subscribe to my channel. Thanks. Bye.